Healthcare Salute really arises from research that we began early on in the pandemic, when we have now surveyed over 1,250 Canadian healthcare workers about their mental health and well-being, and these are healthcare workers across the country. We've also conducted in-depth interviews of over 120 healthcare workers, and from that we asked, what do you need? We found that 1 in 4 Canadian healthcare workers screened positive for a probable diagnosis of post-traumatic stress disorder, and those numbers are now approaching 1 in 3. We found that 3 in 5 screened positive for high levels of depressive symptoms, and 3 in 5 also screened positive for high levels of anxiety. What we also found was that many Canadian healthcare workers are suffering from moral injury and moral distress. And our research showed that from the beginning of the pandemic during the Delta wave, 1 in 4 Canadian healthcare workers were considering leaving their clinical positions. That number has now risen to 1 in 2 Canadian healthcare workers are considering leaving their clinical positions. And they attribute that directly to the moral distress that they've experienced from the pandemic. So using this information that we've learned from the interviews and online surveys, we sought to develop tools and strategies and resources that would address directly the impacts on the mental health and well-being of Canadian healthcare workers that we saw so clearly coming out in the survey and also coming out in the interviews, the in-depth interviews that we conducted.
We had 2 key goals for developing these materials. One was to build mental health literacy in healthcare providers, and the other one was to provide guidance and support to healthcare organizations and mental health clinicians who were supporting healthcare providers. So we have information sheets, fact sheets, just giving information on the topic. What is moral injury? And also giving them tools to build their own coping and resiliency, the guidance and support tools for organizations and clinical mental health providers are there to help them build their understanding of healthcare culture and how that impacts on the work that healthcare providers are doing. We had town halls and symposia, live events that we hosted online. So that was a good way to get up-to-date research out to our audience, which is healthcare providers, administrators, healthcare organizations. We have built a video series, a national video series with healthcare providers from across the country talking about their experiences that really helped to bring alive the research that our researchers were doing. And these stories really paint that picture in a powerful way. The majority of our learning content is set at a reading ease of grade 8, so that people for whom English is a second language or a third language are able to understand the content. All the deliverables that we have developed are compact, quickly consumed, easily digested, with very simple practical suggestions and ideas that they can implement in their practice and in their day-to-day lives to help them manage their well-being a little bit better.
Thus far, we've received really excellent feedback from the various people who we've spoken to about their use of Healthcare Salute. We in fact had one psychologist who was brought to tears by the website who said this is what we need. And we need this not only for healthcare workers, we need it for all who serve. And that includes public safety personnel, military members, veterans. There's a large community of individuals who give at great service and great sacrifice to others. And we really want to be able to provide a thank you for that service, but also the resources and tools that they need to support them.
We are hoping that this website and the materials that we have developed is just the start. We have extension funding from the Public Health Agency of Canada, and for the next step, we want to develop resources for healthcare leaders and healthcare organizations. We really hope that these materials, which can easily be translated into other languages because the language we have used is intentionally simple, will be of use to people around the world, healthcare providers around the world, that they can serve as tools and resources for all healthcare providers.
We hope that these resources will help healthcare workers to feel seen, to see that others have heard about and know their experiences and are better equipped to support them. We also hope that healthcare workers, for example, those at 2 o'clock in the morning who have come home from a shift and are looking for information and resources to help them manage some of the difficult situations that they've faced and their emotional responses, that these resources will be available anywhere in the world for them to access.